So coming to the next topic, which I would like to just cover up, are joints. Pretty just pretty straightforward. So joints are just articulation between two bones. They can, if you look at our anatomy book, the last anatomy, we just goes around them pretty quickly, right? I mean, they might be have elaborated a bit here and there, but the concept is pretty straightforward. Two joints coming together, and we can divide them into three different, ways. One would be the fibrous joints, another one is your cartilaginous joints, and your synovial joints. So it's just a straightforward classification, right? When you go around, you see how, if you look at the order which I just told you, as we go forward, it becomes more mobile. So fibrous joints, as the name itself suggests, it's mostly fibrous, and there's really a lack of mobility there. So you just need to know the examples for these ones. The sutures of the cranium. Now, these are fibrous joints. And other examples would include, like even the head itself. You got another example, which is the gum forces, which is usually, your the tooth, coming articulating with the mandible, the lower part of the mandible. So that's known as gum forces. And also you have the syndesmosis, which is usually the distal tibia fibula joint, which sits just, about the ankle. Okay, so that's one. So that's fibrous joints. Now come to cartilaginous joints. Cartilaginous joints can be divided into primary and secondary. Right? Primary is basically hyaline cartilage. Secondary is your fibrocartilage. So primary cartilage joints. Best example would be hyaline cartilage, which you find at the epiphysis. So wherever you have hyaline cartilage, so costochondral joints, so those things are also examples, fine examples. Then secondary cartilage joints are your fibrocartilage, which the best way to just say this is they sit in the midline. Okay, so your intervertebral discs, your pubic symphysis, all these are fibrocartilage. Now come to the the most interesting one is the synovial joint. So synovial joint. So again, you have two articular surfaces. There's a cavity sealed by a membrane. There's a joint space filled by synovial fluid, a capsule. So this is basically the structure, right? Two joints bound by a synovial capsule within which there's a membrane inside, and that cavity that is formed is filled by fluid. It's straightforward. Right? Now, what are the examples? Right? The best way is to correlate and relate a few examples together. Shoulder, hip, both are ball and socket. Hinge would be knee, as well as your humeral ulna, right? The olecranon and the distal humerus. So that one is your hinge. Then condyle would be the wrist, and the carpometacarpal is what you call a saddle joint. Gliding would be the acromioclavicular joint, and pivot. A pivot is very important because the atlantoaxial joint, C1C2, is a pivot joint, as well as the radioulnar, the proximal radioulnar joint is also a pivot joint. So this is just a few examples, just to quickly go through topics. I feel like this is a very nice introduction to talk or move towards dislocations, because I feel like this is the perfect foundation for that.